أعوذ بالله من الشيطان اللعين الرجيم بسم الله الرحمن الرحيم. Today we are going to discuss by the grace of Allah Almighty a disease in horses, we can say disease in equines. Equines include horses, donkeys, mules. The disease name is allergic respiratory disease. This is a common cause of chronic respiratory disease in the adult horse. Traditionally, severely affected animals, they were recognized by their poor exercise tolerance and pronounced expiratory effort at rest. Although also known as broken wind, heaves or chronic alveolar emphysema, it is best referred to as obstructive pulmonary disease. Obstructive pulmonary disease or small airway disease. So allergic respiratory disease is also known as obstructive pulmonary disease OPD or small airway disease SAD. It is normally a chronic non-febrile disease, but cases do seem to follow acute febrile respiratory tract infection, in particular those with a viral component which sensitizes the horse. The inhaled allergens have two main effects. Number one, direct stimulation of irritant receptors in the larynx and trachea. Number two, introduction of the allergic response. So the inhaled allergens have two main effects. Number one, as I described, is a direct stimulation of irritant receptors in the larynx and trachea. Number two, introduction of allergic response. Clinical signs, so far as the clinical signs are concerned, they may be intermittent with their presence or absence, dependent on the exposure to the allergen. The clinical signs reflect an increase in airway resistance due to a decrease in the airway size, and this produces number one, smooth muscle spasm. Number two, inflammatory response around the airways. Number three, excessive mucus within the airways. Excessive mucus within the airways. So this is reflected in an increased rate and depth of respiration and coughing. So when these three things occur, these three things are reflected in increased rate and depth of respiration, rate of respiration that is increased. Number two, respiration that is deep, and coughing also occurs. Much of the mucus coughed in, much of the mucus which is coughed, that is swallowed by the horse or foals or we can say donkeys or mules, depending upon the situation. In mild cases, chronic cough occurs, normal respiratory rate and character, normal lung sounds, possible serous nasal discharge that occurs. We are discussing about allergic respiratory disease in equines, and at this stage we are discussing the mild case. After that, now comes the moderately severe cases. In moderately severe cases, chronic cough occurs, increased respiratory rate occurs, and effort is also increased. harsh lung sounds with crackles, nasal discharge may also be present, and animal is unable to sustain work without respiratory distress. And next is the severe case of allergic respiratory disease. In severe cases, what happens is there is chronic cough, number one. Number two, there is very rapid respiratory rate, which is 20 to 40 plus per minute, and marked increased effort with double expiratory movement, heave line present, and animal is unable to do work without becoming breathless. And if this condition persists for many days, then weight loss has also been noticed. Diagnostic aids. So far as the diagnosis of the disease is concerned, endoscopy is recommended. Excessive tracheal mucus that is taken and sent to the lab. Tracheal wash, sterile, many neutrophils are present in tracheal wash after examination. Hematology. In hematology, actually hematology is usually normal. Fecal samples, when they are sent to the lab to eliminate possible lungworm infection, fecal samples are sent to the lab to eliminate possible lungworm infection, and response to a dust-free environment for at least 4 days. That is also our diagnostic aid to check allergic respiratory disease. That is very important. Note it please that response to a dust-free environment, that should also be noticed for at least 4 days. And response to the therapeutic drugs, that also should be noticed, and radiography should also be completed. Very difficult to interpret through radiography. The allergic respiratory disease is very difficult to interpret through radiography. Change in intrapleural pressure. Normal intrapleural pressure is 4 mm Hg of Hg, and affected is 6 mm of Hg for more. Arterial oxygen tension, the normal is 90 mm of Hg and affected is 82 mm of Hg or less than that. Now comes the diagnosis of allergic respiratory disease. This presents no problem in moderate to severe cases. Any horse with the respiratory rate in excess of 20 breaths per minute with increased effort, with no evidence of infectious respiratory disease, will almost certainly be OPD. We can say that obstructive pulmonary disease. Other cases rely on history, clinical signs, diagnostic aids, management as well, and the differential diagnosis of the allergic respiratory disease should be done with colic as well, because in colic, in very acute cases, apart from the above findings, the horse also sweats, and horse is uncomfortable in colic, very uncomfortable actually, and may be presented as a colic. Lungworm, pneumonia, these are other two diseases, or we can say conditions through which differential diagnosis of the allergic respiratory disease should be done. Now comes the treatment of the allergic respiratory disease. Treatment is very specific, should be very specific. So specific bronchodilators like clenbuterol hydrochloride, that is recommended, and inhibit or prevent mast cell degranulation. Sodium chromoglycate should also be used. The former is preferred and should be given when OPD is asymptomatic, giving 3 to 4 weeks protection from a 4-day course of treatment. And the main cause, which is allergen should be removed. The most effective measure achieved by the following methods. Allergen can be removed by following these methods: stable management of the highest standard. If possible, keep the horse out of the doors for as much of the year as possible. When stabled, keep the horses away when boxes are being mucked out and as far away as possible from the dung heap. Bedding should be bedding should be of paper, shavings, peat or damp straw with dust kept to a minimum level. So there should be no dust in the bedding of the horses or equines. Feed should also be best hay, dammed or preferably host. Complete cubbed horse food or other conserved grass products should also be used. Prognosis of the disease: the lungs changes are considered to be reversible until alveolar breakdown takes place, as most cases do not develop significant alveolar emphysema until severely affected. The prognosis is good provided appropriate treatment is instigated and maintained. Each exposure to the dust or allergen to which the horse is sensitized will produce a more severe response. The severity of the signs therefore tend to increase with each successive year. Prevention: all horses and ponies, they can develop allergic respiratory disease. It is essential that stable management is of highest standard for all, but especially for young horses that could become sensitized before they even start to fulfill the purpose for which they were bred or purchased. Chemotherapy should be looked on as a means of controlling acute bouts, but not for long-term use. So chemotherapy should be looked on as a means of controlling acute bouts, but not for long-term use. Thank you very much. Jazakallahu khaira.